Well, welcome to Connected by Community. We're glad to have you here to our podcast, and we're excited to be here today. We're a podcast bringing you information about nonprofits, our community, business leaders, interests and ideas, and super excited what we're bringing here today. I'm Brian Ballantyne with Ballantyne Capital Advisors. I'm joined by Anthony Colancheco across from me with Ballantyne Capital Advisors, and we have our guest here today, Joe.Roberts from Wealth Solutions. Welcome, Joe.
Well, thank you. I'm glad to be here, and I hope that the information I share is useful to everyone.
Well, I know it will be.
Joe, so at Ballantyne Capital Advisors, we call you the insurance guy. We give you a nickname.
I'm the insurance guy. Shance is the way that we like to say it down south. Shance.
That's the South Carolina way.
We're going to jump right in here. So why don't you tell us a little bit about yourself?
So I moved to Greenville in 1999, where I met my wife, Shannon, and we have two teenage boys, Benjamin and Nathan. We live in Greer and love the community and have been just super pleased with the choice to move here all those years ago. So,
where are you originally from?
Originally, I grew up in Connecticut, in Bristol, Connecticut, home of ESPN, and I moved. I originally started at Merrill Lynch up in Connecticut, and then transitioned into the life insurance world in 1994.
Got it. So that's why you like Joe so much. He's from the north.
Yeah. Again, surrounded. I'm the only Southern brethren here, right? So, yeah, but here's the thing. You didn't move back, right?
No, I'm not going back. So I'm not going back.
I find it interesting. Everyone I typically meet is really from a different area. So it's good to see other folks from different areas and their background.
Yeah, well, my kids are native, so that matters. And but you're right. Greenville originally, I think, has been such a draw because of the great community that it is, and I know once I got here, I was home.
So I just want to ask with that though, because I see Anthony walking around in a jacket in 100-degree weather. How's the blood react to being down here now that you've been here a long time?
So I'm now acclimated, as we say. So and in fact, I was debating. I almost had a short sleeve shirt on today, but the weather's cool. It's only 78, so I did dress up.
So my youngest was born in Philly, and we're wondering if she's actually going to develop the Southern accent. We're not sure yet. So.
Keep the Philly.
So tell us what you do professionally.
So I have two career paths currently, and the first is Wealth Solutions, LLC. It's an insurance agency that I started in 2013, and that agency specializes in Medicare. Prior to then, and also concurrently today, I run a general agency as well. A general agency is an insurance practice that helps other agents with their clients in terms of product and back office support, etc. So I have two jobs really. It used to be general agency was my primary function, and today that's taken a back seat to Wealth Solutions, LLC, and my Medicare business.
Got it.
Yeah.
Let's talk about that Medicare, because that's kind of one of the things I think we wanted to pick your brain about. In our business, we come across Medicare, and it's whether it's affecting folks today, it's going to probably affect them at some point in time. Mm-hmm. So I guess, what are some of the common mistakes you see people make in Medicare planning or as they approach Medicare?
Well, I think the first mistake is not realizing when to enter, and perhaps starting a little late in the game so that they don't have time to properly educate themselves. So to approach this and get properly educated, you really need 3 to 4 months before you're actually ready to begin. And oftentimes I'll get calls from people who should be already in Medicare. And so I have to help them through the process and get them signed up more quickly than perhaps they might do comfortably. So the big challenge with Medicare is knowing when to enter, and of course that can be age 65 or it can be when you decide to retire. Most people are very concerned about late penalties, and the reality is if you enter at age 65 because you don't have employer coverage or because you've had an individual Affordable Care Act plan or something like that, that's the proper time to come in unless you do have that employer coverage, at which point you can wait until you decide to retire at 67 or 70 or whatever the case may be. So that's the first mistake. I think the other fairly common mistake is once they're in, not doing regular checkups on their Medicare plans.
And there's a lot of choices with Medicare, and it can be complicated. And
Yes.
Boy, we probably don't want to go down this rabbit hole. I personally, because my wife has had some Social Security disability, she has been on some Medicare stuff, and that's a whole nother thing that we probably have to have a discussion in and of itself.
Right.
And doesn't affect most people, hopefully. But when we talk about just general Medicare planning, there's a lot of options. You have this, of course, you have A and B. Most people are familiar with that. But you have this thing now, C and D and all these other alphabet soup. So how does someone address, picking those out? Obviously, they can come to someone like yourself, which we recommend.
Right.
But how does someone even start that process?
Well, so generally, what I do with most of my clients, and I really recommend this for everyone, which is to go to Medicare.gov, which is a fantastic website. It's been changed a lot over the last 2 or 3 years, and it's actually very easy to find the information you're looking for. But there's a pamphlet out there called Choosing a Medigap Policy. That's one option. The other is usually around age 65, you'll receive in the mail Medicare and You Handbook. Those are two great resources to begin if you wanted to educate yourself. I do take great time in using that Choosing a Medigap Policy booklet to educate my customers. I do what I call a Medicare 101. Helps them understand what Part A is, what Part B is, and then the other alphabets that would surround Parts A and B. So that's the first place I would start is with Medicare.gov.
Well, and I know for myself, I've helped clients with this for years and certainly have worked with you. Until you've walked the walk, it can be difficult. And having seen, again, with my wife walking through it, I think a lot of people might be surprised. It's a lot more complicated than a traditional plan where maybe you work for Michelin or BMW. Yes. And you just had a plan and they gave you the plan and maybe you had 2 or 3 little choices with your deductible. It's fairly complicated when you start talking A, B, C, D, L, F, G, whatever. What part is that going to cover? What do I need to show? And then you take it on top of that. As we begin to age, someone gets into their 70s, 80s, and perhaps they're fortunate to live in their 90s. They're managing this. So having a professional like yourself, I think, is immensely valuable because these rules are constantly changing. It's complicated, wouldn't you say?
Oh, it's hugely complicated. And I think partly because when Medicare came out in 1965, it was actually fairly simple. But over the course of 50 years, they've added parts, and prescription drug coverage is an excellent example, which is perhaps the most confusing part of Medicare. Medicare Part D, prescription drugs. That's very confusing. It was added in 2006, and at the time, I think it was widely acknowledged that the government didn't have the money to fully fund that. So they created donut holes and gaps in initial coverage and deductibles and all sorts of other things that make it really difficult to follow and understand as a new recipient, a new beneficiary of Medicare. So for those things especially, I really do recommend that you get some professional help with a local agent. You can, of course, pick up the phone, as Joe Namath likes to say, or J.J. Walker, right? I saw him on TV the other day, Jimmy Walker. You can, of course, call an 800 number, but those folks are going to assist you through the process of making a sale, as opposed to perhaps really getting to know your situation and then walking you through the 4 moving parts of Medicare. If you'll allow me, I'll just expand briefly. So you have Medicare Part A, which covers hospitalization. You have Medicare Part B, which covers doctors, outpatients, labs, x-rays, things like that. The next choice, which is where people usually rely on an agent to help them, is what do I surround my Parts A and B with? Because they're only going to cover perhaps 80% of the cost. So that's where Medicare Part C comes in, a Medicare Advantage route, or traditional original Medicare, where you would purchase a supplement and a drug plan. So it's hard to know how all these tie in, but for many people, there's 4 moving parts to Medicare. And knowing which part covers what and what your outlay is going to be is really important.
Joe, where do you see people getting confused or having problems with Medicare?
So far and away, the biggest confusion to people is Medicare Part D, the prescription drug plans. Because of how it was created and because of some of the subsequent changes. Additionally, people have gotten used of apps like GoodRx, etc. And so in Medicare Part D, as I mentioned, there's 4 stages that you have to be concerned with. There is, of course, the deductible. So you pay a premium and join a plan. Once you're in the plan, you may have to deal with an annual deductible. Once you've met the deductible, you go into something called initial drug coverage, where there's a cost share between the government, the plan, and yourself. And then you may enter the gap, where the cost share changes dramatically. Well, that gap has changed a lot, especially since the Affordable Care Act came into play. The Affordable Care Act mandated that what we called the donut hole go away. And then once you've finished with the gap, you then, believe it or not, go into catastrophic coverage. So there's so many different phases, and the numbers change year to year where those different coverages begin and end. But it's all contained in what they call Medicare Part D, which is pretty simple to understand, right?
Yeah.
Well, and I want to piggyback because I personally have been affected with this catastrophic coverage. Having a wife that has a lot of drug needs due to her medical condition. One of the things people would be surprised to know, I think, should you have a heavy drug need in some of these designer drugs, as I call them, that are $100,000 a year. Most people are used to, when they worked for Michelin or BMW or Duke Power, of having an out-of-pocket cap. So I'm going to ask you a question, which I already know the answer to. Is there a cap in Medicare Part D drug coverage if I have to spend $1 million in drugs? Is there any cap associated with the government?
There is not.
I'll say that again. There is
not
right.
a cap. So when you get to catastrophic coverage, which is at, I think next year it's going to $6,550. But once you've hit those out-of-pocket expenses, you still have to pay 5% of the cost of the medication. So if your medication is $10,000 a month, and there are many that are, then you're still responsible for $500 a month.
That's on top of your deductible.
On top of your deductible and all the other expenses you paid to get to the gap. So it can be very, very expensive. And in fact, I tell many clients that if you're fortunate and not taking many medications in Medicare, that's great. But eventually, it may become the most expensive part of anything you do in Medicare is the drug coverage.
I absolutely concur, and I just wanted to hit that because I do think whether someone hits that at 65 at some point in their life, it could be when they're 83 or 84, and drugs seem to continually getting more and more expensive. Mm-hmm. You know, the drug that you used to take that solved your problem for $30 a month, magically now $350 a month, and that can escalate, taking more and more of these.
It gets really, really expensive, and I think the point that I try to make to people is, even though you have drug coverage, it is important that, and this also makes drug coverage confusing, you need to check pharmacies. Is there a cheaper pharmacy that I could be using? You need to compare to GoodRx, because in many cases you can purchase the drug outside of your drug plan cheaper with GoodRx or other such apps than you can purchase inside the plan. And so you have to weigh all these factors out, and that's part of the process of educating someone as to, you know, how to go about getting their coverage and what plan works best. Equally as important, though, is once you're in there, each year there's an annual enrollment period where you're allowed to make changes to your drug plan. And it's really very, very important. One of the most common mistakes, as Anthony had asked, that I see is people enter a drug plan and then they stay in that same drug plan. They don't bother to go back and recheck their data. In fact, the drug plan's formulary could have changed, or their medications could have changed, or their drugstore could have changed. So all of those things go into managing Medicare once you're in it, and it's ultra important that people do an annual checkup.
What are those dates? So if I'm in it and I have this annual checkup, when should I be doing that checkup or thinking about those type things?
So each year, October 15th begins the annual enrollment period.
So coming up soon.
It's coming up very soon, and it ends December 7th. And I tell people the way to think about that is if you're used to working and say you were at Michelin or Floor or wherever, each year during the fall, you get to pick your new plan for next year. That's what the annual enrollment period does in Medicare. It allows beneficiaries to choose different plans for the upcoming year.
Gotcha.
October 15th through December 7th.
Critical dates.
Critical, and it is my most busy time of year because I do take time to try to contact each and every one of my clients. I have hundreds of them, but I do try to call every one of them to make sure that they're in the right plan for the coming year.
So get on the calendar early.
Yeah, exactly. After December 7th, I go dark for about 2 weeks to recover. So
there are folks that are listening and are probably in their about 64, 65, or getting ready to retire. What steps should they be taking?
So the first thing is you've got to determine if the employer you're working with has credible health insurance coverage. So if you're 64 or 65 and already on Social Security, you're going to be enrolled in Medicare automatically. If you are still working, then you must take action to enroll in Medicare Parts A and B. And that involves either going to Medicare.gov or calling the local Social Security office to enroll in A and B. You may not choose to do that if you have credible coverage with an employer, because that coverage can continue past 65 and you may want to keep that coverage. If you enroll in Medicare, while it will be primary, the primary payer, it often reimburses at a lesser rate than private insurance. And so you may be experiencing an expense with very little benefit. So you don't want to enroll in Medicare until you're actually ready to use it.
How far in advance? So if I'm going to retire at 67, how far in advance do I need to apply?
So you cannot apply more than 3 months before you're ready to use it. So that is regardless of whether you're retiring or aging in at 65. You cannot start the process before 3 months. I often recommend about 6 months before you contact an agent to have a discussion about when, how, and preliminary estimates on costs. And further, if you are in a plan through your employer and you're 67, it also might make sense to do a cost comparison. What would Medicare cost me versus my employer plan? Because sometimes employers are more expensive than Medicare, and sometimes they aren't. So you can keep working if you wish, drop the employer coverage, and go to Medicare if it's a less expensive route. That's just a simple cost analysis.
I'll tell you, I was actually thinking about this. I don't think I mentioned this to the camera, but I've known Joan for a long time, probably 15 or more years.
Probably 20, close to 20.
Probably need to go back and count it, but
yeah.
Does an excellent job for folks. But I think one of the critical things that you do is what you just mentioned, whether it's 6 or 9 months before, that pre-planning, so that you've had time to think about it before you start pulling the trigger. Because although October 15th to December 7th might sound like a lot of time, or 3 months ahead of retirement might sound like a lot of time, these time frames get crunched when you're making a lot of other decisions. It's not just Medicare on your plate when you retire from working somewhere
Right.
20, 30 years. So I love the idea, while you have peace, calm, and time on your hand, 6, 9 months out, make a preliminary meeting with you, go through the options so that you get educated, get the education part out of the way, study up, and even the plans might change, you got some of that work done. So I value that and think that I would tell folks take you up on that, do that, whether it's you or someone else. I think doing some preliminary work is really critical and not making a rash decision at the time.
Well, and I agree 100% because you do have a full plate as you approach retirement. But more importantly is people come to me quite fearful about what if I make a wrong decision. And by allowing time that when, how, and how much, those things are all covered before you're ready to enter. And it can alleviate a lot of the concern and fear. Because while it sounds complicated, if you deal with someone who's an expert in the field, it actually becomes fairly easy. And oftentimes, 2 and 3 years into working with me, clients will be completely comfortable with the whole process, and they now understand Medicare more completely.
So I want to ask one last question. You mentioned change. So if I don't know what I want to do, and I'm a new retiree, and I go on this new thing, Medicare Advantage, but I'm not sure about that traditional supplement. Just talk briefly about what options someone has to change and what that might mean, because I know I have had that question that's kind of out there a lot in the news media. What are people's options and going back and forth in those two?
Okay, and that in of itself is fairly complicated. So,
well, it's my last question. So,
well, I'll try to keep it brief. But when one comes into Medicare through their initial enrollment period, which is let's say age 65, okay, then you have guaranteed acceptance into a Medicare supplement. So you can be extremely ill and have lots of health conditions and still get the best available rate in a Medicare supplement. You can also come into a Medicare Advantage plan at age 65, and many people like those plans for some of the additional benefits that they get over and above Medicare. The government, though, once you've gone into a Medicare Advantage plan, they allow all beneficiaries to have a 1-year free look where they can try the Medicare Advantage world. If they choose to stay in that world longer than 1 year or 12 months, then to come back to original Medicare, you have to answer health questions. There is some brief underwriting that's required. So in simplistic, I guess the easiest way to think about it is I can always go from a supplement to a Medicare Advantage plan, but I cannot always come from a Medicare Advantage plan back to a Medicare supplement. And if I am allowed to come back, it may be at a much more expensive rate than I could have gotten in my initial enrollment period. So you have to approach Medicare Advantage. This is the part that Joe Namath and Jimmy Walker never tell you, is that you may not be able to come back to original Medicare. Medicare Advantage plans have significant maximum out-of-pockets that are, this year, the maximum out-of-pocket $7,500. So if you, and that doesn't include drugs. That's right. Just for healthcare. So if you had a health event, it could end up costing you a lot more in a Medicare Advantage plan than it would have in a supplement. So you have to really weigh that out.
So they're trying to get people not to abuse the system. But what I'm hearing you say is if I'm on Medicare Advantage, I got the 1-year free look. But don't wait till you're 74 and the knees start going and you're having a lot of medical issues. If you want to then go back to the more lucrative plan for you, it's either going to be costly or prohibitive and not allowed.
That's correct. And so you have to go into a Medicare Advantage plan eyes wide open about, am I going to exit? Now, if you're lucky enough to live 20 years with very little health issues, Medicare Advantage can end up saving you a lot of money. But for many people, that gnawing idea that I may not be able to go back is simply not worth the savings, because eventually, and this is the best way I can say it, pay me now or pay me later. And with Medicare supplements, it's a pay me now plan, but you can budget, and it's very simple to understand the cost. Medicare Advantage is more complicated.
The bottom line I'm hearing is call Joe.
Yeah, thank you. That's correct.
I'm going to change the subject real quick.
Yeah.
We have a signature question on the show, and it's, what makes you tick?
Well, so I like helping people. It's interesting that Medicare has taken over my business career, because it's far and away of all the things I've done in my life, career-wise, it's far and away the least lucrative. But it's the thing that I enjoy the most, because people are literally, I have some clients who are absolutely terrified coming into Medicare. and helping them through that process is so rewarding that I think helping people and learning about people, and I'm a people guy, so I like having the time with my clients to get to know what they're trying to achieve and then guide them on the best path.
Great. So where could folks find you?
Well,
Or contact
you can dial me at 864-979-7770. That's the 7 number, right? 864-979-7770. Or you may email me at Joe.Roberts at SC, like South Carolina WealthSolutions.com.
Joe, thanks for being here. We really appreciate it. I learned something like I do always, and I know our listeners will. And I think one of the things that I've really gathered is you got to get some professional help, whether it's you or somewhere else. It's a lot of stuff to think about. And certainly, having known you, I would certainly recommend people at least consider talking to you. I know you're a good guy, and we'll help folks out, so we appreciate it.
Well, thank you. I appreciate the opportunity to talk with you and Anthony and your friends and clients out there.
Well, thank you so much. Thank you all again for joining us. This is Connected by Community, brought to you by Ballantine Capital Advisors. We hope you'll join us next time. And until we see you again, go out and make our community great. Bye-bye.